אז שלום לכם שוב, וובינר שני עם דוקטור מייקל קורדינו על השיטה נוירופונקטורה, Neuropuncture. אני אילי ואני מארגן את הסדנה עם דוקטור קורדינו פה בארץ. מוזמנים לשאול שאלות בצ'אט תוך כדי, ואנחנו נתייחס או בלייב או בסוף. So Dr. Corradino, it's great to have you again.
Thank you. Pleasure's mine.
It's less than a month till you arrive and we start our workshop.
I just got excited there and a couple palpitations when you said that.
Yeah, that's really exciting.
It is.
So maybe today we'll start with talking about the workshop itself.
Great. So those of you that are coming, our seats are becoming a little limited. So let's get everyone in there. And what we're going to do for everyone is we're going to be giving everyone a 10-day complimentary access to NeuroLab. So if you're not familiar with NeuroLab is the Neuropuncture online training platform. So practitioners all around the world can access that and access our content and train with us. And what we're doing is we have a special little workshop portal that we're going to give access to all the attendees, everyone that registers, for 10 days before. And the reason is because I am really excited to come to Israel and share with you what we have done since I have been there over 10 years ago with Neuropuncture. And the system has evolved so much. And I think we've really perfected on how to deliver it so that the practitioner can comprehend it and then apply it immediately. And in doing that, that's why we give it 10-day access complimentary to NeuroLab. So you can start to review some of the fundamental videos and webinars on the neurophysiological mechanisms and some of it on the history. Because in the process of creating the 3-day workshop, that's something that is a very creative process for me. I thoroughly enjoy it. My instructors that I am training now, some of them are not in that area yet because it takes a skill and it's very artistic to do that. So they are not in that area yet, and I'm in that, and I love it. It is so much fun. And I had to really make sure that I wanted to present this properly so that everyone understands it, the flow is correct, and again, you take as much as you can from the workshop. So the first day, it's going to be a big day. And this was my thought and creative processes when I put this together. And I figured the first day will set the pace for the rest of the weekend and the rest of the workshop. And on the first day, there's a lot, but I know we're going to get through it. It's going to be a lot of fun. So day one, we're going to start with a little deep dive into the history, the accurate historical acupuncture timeline. Okay, where it was first originated. Yes, we know China, but the time frame, the cultures that surrounded it, any empires that might have migrated and pollinated some of the information around that part of the world at that time. And then we're going to look at the evolution of medicine. And we're going to really understand the roots of classical acupuncture and how it has developed into the evolution of neuropuncture. And then once we get that 21st century neuropuncture medical mindset, by understanding the history of acupuncture, understanding it always was neuroscience, then we could jump into a little more advanced work and start going through the neuropuncture system. And what we're going to start with after that is going to be the Trinity. Now, that's why we give you a 10-day complimentary access. We're not going to go into the depths of the Trinity. It's too much. That literally is probably like, we do that in the certification program. The first 8 weeks, we go through the entire Trinity. 8 weeks. That's how much time we spend on that. So I don't want to dive into it that deep, but I do want to introduce you to it. I do want everyone to start to understand the neurophysiological mechanisms of acupuncture, how we create treatment principles, and then the electrical techniques or the dosages. And that gives you the tools to create your own prescriptions and treatment plans on your own. That's why we say with neuropuncture, it's a complete system, and we're giving you the tools to catch your own fish. So that is in the beginning. And then that's not all of the morning. I also want to squeeze in there a little bit about neuropuncture needling. So we're going to get some needling technique in the morning, how to proper needle the Huatou Jia points, some of the facial points in neuropuncture, like the trifacial neuropuncture node, the greater auricular neuropuncture node, some of the Huatou Jia in the lumbar spine, as well as some of the acunodes on the legs as well that are specific to neuropuncture. And why are we doing that? Because you're going to see those nodes we're going to use throughout the weekend. Okay, so a nice little introduction to it then. Then we're going to finish the morning with a little bit of introduction and training on electrical acupuncture and why this is so important and how that can not only change your practice, but literally your community. That's what I believe neuropuncturists should do. We should plant ourselves in a community and take care of that community. And with one device in our training, you're going to learn how to treat internal medicine, mental health, and pain and orthopedics, which brings us through the rest of the workshop. But before we even get to those next 2 days, in the afternoon, we're going to be introduced to the neuropuncture auricular system, another complete system by itself, neuroanatomically sound, research supported, electro-acupuncture of the ear. But we're not going to even do the whole system because just like the Trinity, it's very complex. So all we're going to examine, which you are going to love, is 1 out of 2, but one of our advanced vagal nerve stimulation modules and techniques that we do in the neuropuncture auricular system. You're going to love it. The vagus nerve has gotten a lot of attention. We've dove very deep into the examination of the fibers of the vagus nerve, how to recruit them with electrical signatures to modulate them and repair them for our patient's health. Amazing. That's on day 1. Then at the afternoon of day 2, after the auricular, we're going to dive into scalp. And the neuropuncture scalp system has a lot of interesting and different techniques, but I want to introduce a few nice strong ones to you. And a couple of them are some deep needling with high dosages that are extremely neuroprotective and extremely beneficial to a lot of patients with brain conditions. But also there's some needling techniques on the neuropuncture scalp system I have to share with you. And that is threading perhaps 4 or 5 needles into a specific area of the brain and then attaching electrodes to create a little electromagnetic field to target then and then stimulate the cortical structures underneath it. And that's our neuropuncture scalp system, but we're only going to do a little piece of that as well. So the first day, I know it's a lot, but trust me, you're going to enjoy it. And I'll take all your questions and I'll make sure it's very well clearly explained. And I have wonderful Eli there to help you with the Hebrew. So real quick synopsis of day 1. We're going to go into the history of acupuncture, and we're going to go into the Trinity a little bit, and then a little bit about the needling techniques that we're going to do in neuropuncture, and then electroacupuncture and how to demonstrate that in the morning. Then in the afternoon, the auricular system, vagus nerve, and then the scalp system, some nice deep needling, and then special electrical stimulation on the scalp. That's just day 1. Okay. You ready for day 2? So remember what we said, neuropuncture being a complete neuroscience acupuncture system using electroacupuncture, we're going to be able to treat so many different conditions that in day 2, all I want to focus on is orthopedics and pain management. I know we have a lot of that in America, and I'm sure you guys do as well in Israel. Acupuncturists see a lot of pain management, a lot of orthopedic cases. So in day 2 is only going to be pain and orthopedics. And that includes physical assessment, orthopedic neurological evaluations, as well as needling and e-stemming for certain conditions. And we're going to cover lumbar pain and sciatica, and then we're going to cover cervical pain and herniated discs and whiplash, all for the back and the spine. And then in the afternoon, in day 2, we're going to do osteoarthritic knees, and then medial meniscus injuries, and then neuropathies. And the lower leg neuropathies is some very advanced work that we've been doing with the new Pantheon and how we can use pulse width to recruit a specific fiber that's pathological that's creating the neuropathy. So not to get confusing, but if a patient comes in with diabetic neuropathy, 3 cases, one has burning feet, stabbing, burning pain. The other one, no burning, cold sensations, possible, very much possible presentation. Another one, paresthesia, not cold, not hot, just tickling and numbing, tingling down the feet. Those are all 3 different neurofibers. And this one's actually a combination of neurofibers that we can recruit with the proper device to specifically target that pathology to correct it. And we'll be going over that in the neuropathies in day 2. And then in day 3, I want to break up that to mental health and internal medicine. And mental health, we're going to go over depression, which is some great work we've been doing. One of my initial prescriptions I created many, many years ago. Insomnia, another very, very, very important prescription, an area of health for all of us, I'm sure, as you guys all know. And then we're going to go in the afternoon to internal medicine, and we're going to complete Parkinson's, neurodegenerative diseases. And with COVID, there's been actually a lot more instances of neurodegenerative diseases. So we'll talk about that. And then we're going to go into specific requests that Eli asked for, and that's our PTSD program. And we have a lot of things that we've learned now from day one that's going to carry over to day 2 and day 3. And I think you're really going to understand everything. And my goal is to get it so that you can apply these techniques the next day, Monday, in your office with your patients.
Wow, that's so much. It's going to be intensive and awesome.
Definitely.
So I have a few follow-ups.
Please.
Some of them aren't planned. So you mentioned in the needle techniques that we're going to do the Huato Jiajis.
Yes.
Maybe you can elaborate a little bit more about the historical connections.
Please. Oh, I love this. So Huato Jiaji needling and Huato Jiaji points, nodes, are so powerful. You know, it's really quite impressive, the history of the Huato Jiaji nodes, acupuncture nodes, okay? As you probably have known and realized, they come from the surgeon, Huato, who was a master surgeon in China. Now, he was a surgeon. So again, remember that solid, very strong affirmation from the scholars from around the world that study Chinese medicine. What do they all say? There's no comparison to the Chinese kanji of qi and the Western term of energy. So that concept was never there in Chinese medicine. I'm sorry to say that, and we'll discuss this in detail. So let's take this back to Huato. So Huato, not being energy-based, being a surgeon, right? And I'll tell you about the historical surgical techniques that he was providing that were very groundbreaking at that time. So what are the Huato Jiaji points? And they actually were the original back shu points. And what are back shu points classically for? Regulating the organ functions. So the actual classical Huato Jiaji points are the classical back shu points, and they are actually the innervations of these dorsal rami, these little nerves that come right out of the spinal segment where the organ innervates. So every time we're needling Huato Jiajis, we're transmitting a little signal into the spinal segment. These visceral reflexes are being modulated from the organs. Now, what's really impressive is, number one, the thought process that Huato was thinking about when he decided to needle into a nerve or stimulate that nerve from the outside to communicate with the organ is absolutely genius, right? And the fact that now we know that there's visceral plexuses, which he was probably very aware of. Back then, we'll talk about the anatomy that they knew. And they knew the difference between afferent and efferent nerves. Real quick, can any of you answer that question? Think about that. He knew that at 160 AD. Difference between afferent, efferent, cranial nerves. So he was a surgeon. And the Huato Jiaji points are those beautiful points, right? Just below the vertebral processes, right in between. Very neurologically sound. And for us, you're not going to stimulate them if you just go really shallow. You'll stimulate these fibers that we'll discuss, but to really activate those spinal segments for visceral modulation, we have to needle down into the muscles, and the little muscles there are the multifidi muscles or the multifidus muscles. And we want to needle right into those. And it's a great example and a great demonstration. And every attendee, I always make sure before they leave the workshop, they're comfortable doing that. And let me tell you something, that alone, I think, is just such a service to our profession, because when it comes to any organ pathology, any organ pain, Huato Jiaji points are fantastic. And I'm going to teach you with electrical signatures how to modulate their function and pain management, but you got to needle properly. And it's really great. So definitely needling Huato Jiajis to tap that lateral process of the vertebral body is really nice. You don't always have to, but I'll definitely demonstrate that and have everyone walk around and feel the bone under the needle. And that is, you're going to see amazing impacts on your patients, especially anyone with spinal pain, herniated discs, right? Whiplash, neck injuries. You have to needle into those small muscles.
Well, I've been doing it for a while. neuropuncture for a while, and the results are by modulating the nervous system with the Quato Giagis is really taking it a far away, like, in a better, in my opinion,
Yes.
in my clinical
Experience. Yes. Right.
yeah.
And you know what it is what we're doing is all we're doing is identifying with what structures we're communicating with. Right. This is classical acupuncture, if you ask me. Huatou, that's what they were doing. And the brilliance, again, to insert a fine needle to stimulate those fibers to communicate with the organs was genius. And then when you understand that, and then you know how to apply it, then that really gives us a lot of power in the clinic to impact our patients, whatever they're coming in for, right? Could be pain, could be visceral function. So very, very effective. And then we have some facial nodes as well that I know are very sensitive, like the trifacial. How do we needle that one? Very nice. We're not needling perpendicular. We're not trying to puncture the nerve. So I'll be teaching a lot of how to thread the needles over certain areas. That's gentle, but still accessing the nerves properly. And then there's some nodes that are special to neuropuncture. You know, what that was, how that was created was once we understand that acupuncture's neuroscience, we're communicating with the nervous system, then we can start to think, well, what other access nodes in the body do we have to access the nervous system that might never have been an acupuncture point, right? And there are a few. So I have a couple that I've kind of created, and we use that great for certain cases. And I'll be teaching those as well that are kind of specific to neuropuncture. But needling is so important. And that's day one. You'll love that. It's going to be a great day.
And let's take something from day 3. We mentioned that we're going to learn more about depression. So maybe you can share us with us some of the research and give us a sneak peek into what it's going to be.
Absolutely. Thank you. I forgot about that. That's right. We're going to discuss depression for you this today. So we are going to be going over that in the workshop, day 3 in mental health. And that is one of my very early prescriptions as well. It's a very simple prescription. It's 4 needles. That's it. 1 point is bilateral. So 3 nodes actually together. 2 hertz millicurrent for 30 minutes. So the dosage is very light. It's an easy device. It's an easy stimulation that can be replicated also, make sure everyone understands this, by other devices. So if you don't have a Pantheon and you have maybe another device that's maybe that you have there and you can't afford a Pantheon, or you don't have one and you're coming to the clinic or to the workshop, I'll be bringing some you can use. And if you have something on your own, bring it. 2 hertz shouldn't be hard to find on any device. And 2 hertz is, like I've mentioned before, is like simply lifting and thrusting. That's the signature of 2 hertz on the nervous system. So every time our doctors, our predecessors, like Huatou is just doing lifting and thrusting, it was like 2 hertz on the nervous system. So with 2 hertz on our depression prescription, Yintang, Do 20, and a tibial neuropuncture node, bilateral, 4 needles, just 2 hertz, has a profound impact on the brain for depression. And again, using the neuropuncture model, our neuropuncture assessment, clinical assessment, would not be, liver blood deficiency or phlegm mist in the mind. We want to figure out what is pathological that's damaged, that's causing this patient to have that depression. And when we look at that neurobiological, we're looking at the prefrontal cortex, maybe the dorsolateral prefrontal cortex, the dopamine generic system, the serotonin system. And we're going to look at certain neurotropic factors that if we can increase those, that will help heal the brain. And usually, not always, but there can be a neuroendocrine component to depression, especially with women. Not only women, men as well. As when we get older and we lose our testosterone, depression can fall into them as well because of our endocrine system being deficient or dysfunctional. So that prescription supports neuroendocrine as well as dopamine, serotonin, and BDNF and GDNF, brain-derivative neurotropic factors, and glial cells line neurotropic factors, which are very influential. We'll be discussing this at the workshop on how they basically repair, heal, and help keep neurotransmitters and neurons healthy in the brain. So having that simple 4 needle prescription with just 2 hertz has this profound of impact on patients with depression. And as we know, in mental health, we'll talk about this, there's a lot of conditions where depression may be an element of it. So you can put this in a lot of other conditions where they're depression is, So there might be other conditions that patients suffer from where depression is a symptom that we can also address. Now, research. Okay, so this is really interesting. So one of our doctoral candidates who graduated with his doctorate in neuroscience acupuncture, he's a DO, a doctor of osteopath, and an MD acupuncturist from the UK. And he took a year sabbatical. This is actually a great story. And this is probably good for any of you out there as well that might unfortunately be thinking this as well. Just before he met me, he was about to quit acupuncture. He was about to stop doing acupuncture and get back into engineering, right? Second career, right? Because he didn't feel it wasn't fulfilling to him, and he wasn't successful. It just wasn't, nothing was working for him. So he met me, he wound up taking a year sabbatical, and he wound up completing the certification program and the doctorate program in 1 year, which is very impressive. Obviously, he's well trained and he's very motivated, but his research was on major depressive disorder. And what he actually did was he had his patients pre and post tested by a psychologist using a particular depressive scale in psychiatry. And what was so remarkable about that was not only did every patient improve from the treatments, there was an average of 64.5% improvement, an average. And the doctor that wrote the pre and post reports up and did the exams and the assessments actually wrote in his report that all the patients diagnostically met the criteria for major depressive disorder. After the treatments, none of the patients no longer met the diagnostic criteria for major depressive disorder. And we have some dopamine ZRT lab tests with those that confirm neurotransmitters being stabilized and increased. And the biggest thing was just the patients. I mean, patients who have really severe depression, we've seen those in clinic. They wound up staying home. Their life is very, very straught with isolation. Everyone around them can obviously be impacted by this. They're not experiencing the joy of life. There's a lot of reasons why that may happen. And that's why we always like to integrate everything we're doing in a medical system or a medical plan, holistic health plan. So counseling and anything else that these patients may need. But we've seen with just that prescription and a modification, which I'll be teaching, very, very effective, very effective. Very proud to say that. Actually, the highest patient had, I think it was like a 96% improvement. Mm-hmm. It was really, really remarkable. And that was not done by me. It was done by a candidate, and an independent psychologist was doing the assessments. So very, very nicely done.
And I think you can find this practitioner's testimony or story also on the Neuropuncture YouTube channel, right?
Yes, so exactly. Yes.
If anybody wants to dive deeper into it, you're more than welcome.
Yes, he's got a great story. Yeah. Good story.
So it's actually exactly a month from now, the 10th of May. We're just ending the workshop. So how does a practitioner, how does he end the workshop? How does he go out and what he can do with the knowledge?
Perfect. So first, we will all leave with a very nice picture and a nice little certificate showing that you've completed the workshop. So you have a nice something you can hang in your office. I think that's always nice to leave with something. But more importantly, I'm going to be giving special discounts to all of you that attend so you can maintain access and maintain a membership in NeuroLab. Anyone that has a NeuroLab membership with me has my undivided attention and has access to me. If they're not a NeuroLab member of mine, I really can't help them because I have no idea what their acupuncture training is. And when you study neuropuncture from us, what you're going to learn is that it's not your normal acupuncture. You need to know your anatomy, your electrical sciences, and it's quite reckless if I just spit out information to practitioners. They might hurt someone, and I don't want to get involved with that. But if you remember, I can point you where to go. I can have you submit a case. So that's one thing. I'll give a discount, a nice large one, so you guys can get into the platform. So you have direct contact with me always. So you'll have that continuing educational and that continued support. Two, Eli is going to be in Tel Aviv, and he's going to be working closely with me. So you're always going to have access to Eli, and Eli has direct access to me. And we're going to be building a nice neuropuncture community out there in Israel. We think it's very important for the profession. And then three, most importantly, maybe, is we're going to give you the tools. So as soon as you leave the workshop, I want you to be able to start talking about what we did over the weekend with your patients, making sure you could perform the procedures and the needling and the electrical acupuncture prescriptions on your patients on Monday morning. And that's what we're there for. So you let me know throughout the workshop, Doc, I need help with this. Hey, Doc, can you help me with this? I don't get this needling. Before you leave, you will. I always make sure that's really important.
Awesome. Anything else we discussed that we wanted to talk?
Oh, yeah. We're going to the hospitals. We have some nice pro bono work. We're going to be having some dinners. If anyone would like to join us, we'll sell up some nice stuff. We're going to have some good times.
Yeah, so let me just elaborate some more about it. So we are going, hopefully, to schedule some hospital visits and working in different departments in different hospitals. So I don't think it's going to be open for everybody, but if you have any suggestions or would like to invite us somewhere, just contact me. And we're going to do pro bono workshop in my clinic in Tel Aviv. So this is an open invitation for you, other practitioners in Israel, to send cases, to send people that will meet me and Dr. Corodino for completely free treatment. It could be cases that you're stuck with and there's no improvement. Or Dr. C, what other cases you think are fitted for us?
So I would recommend anything that you're having trouble with. First of all, if you're having like a stubborn case, I need some help with a different approach. Always welcome those. Right now, neuropathies tend to be something that's difficult. We have some amazing treatments for neuropathies. For severe PTSD, we have some really great advanced treatments for things like that. Addiction, I don't know how that is in Israel. I know in America, unfortunately, we're having a little bit of a struggle with that since COVID, especially with alcohol and cannabis and other things, unfortunately. And that, again, also just damages people in community. So addiction, neuropathies, PTSD, anything like that, we would love to treat. Your tennis elbows and your carpal tunnels, you guys can do that. I'll teach you how to do that at the workshop.
Okay, so I'm gonna let the attendants see if anybody has any questions. This is the time to write them because we're gonna wrap this meeting up. I will say that if you're thinking about buying a Pantheon machine, we both of us were not getting any commission out of it, but it takes time to manufacture them. So Dr. Michael is with good contact with the producer of the machines, and if you want, we can be sending them in advance for you to arrive for the workshop. So just contact us if you're thinking about it.
Awesome. Absolutely. And I should be able to get a little discount for you. And the quicker we get that order, the quicker I can get it to John. John will send it out before the workshop, and then I'll teach you how to use them. So any questions on any of that, please just contact Eli and we'll help you out with that.
Okay, let's see if there's any questions on the Q&A. No questions. Awesome.
I think we're good.
Good. So thank you, Dr. Michael.
Thank you, Eli.
And I'm going to switch to Hebrew just to finish this up. אז תודה לכם גם שהקשבתם, אני מקווה שהיה מעניין. אם יש שאלות, אז אתם יכולים כמובן לפנות אליי ישירות. המקומות בסדנה מתחילים להתמלא, וזה מקומות מוגבלים, אז אם יש עוד איזשהם התלבטויות, כדאי לעשות את זה עכשיו. Oh, I'm just going to tell them about the discount for the workshop. החלטנו להאריך במעט את ההנחה שיש לסדנה, ובעצם אנחנו משלמים 12% עד יום ראשון ב-12 בלילה, זאת אומרת עד אחרי ליל הסדר וכל החג הזה. אז אל תחכו לרגע האחרון, ונתראה בסדנה. אוקיי.
I can't wait to learn some Hebrew. I can't wait to learn from Hebrew when I get there. All I know is shalom.
We'll teach you some.
Definitely.
Okay.
All
So
right.
thank you very much.
Thank you
תודה
guys.
לכם על
Looking forward.
ההשתתפות.